Hello people, in this video we want to look at tuberculous meningitis. This is caused by Mycobacterium tuberculosis. Where is it written? They didn't write it. Okay, anyways, we will say it is caused by Mycobacterium tuberculosis, a bacteria. It is actually tuberculosis has many forms, and this is the most severe form of tuberculosis. Which is the most severe form of tuberculosis? Meningitis. Tuberculous meningitis is the most severe form. Okay, so especially if people have malnutrition, it can easily attack. Okay, that's why nutrition is very important in pediatrics. Now here what happens, there is something called as a rich foci, which you should know. How is it doing all this damage? Rich foci, what is this? Look at this. This person will inhale this tuberculous bacilli, and then it is going to the lungs, and from lungs it's going to the bloodstream, and very easily it is entering it's going to the brain, and brain it's forming this rich focus which will then burst and it will reach the subarachnoid space and cause meningitis. Okay, so there is primary infection which is followed by basilemia and seeding of meninges. So it is going to seed and it is going to form a foci in the brain, right? And then what will happen during stress or a low immunity level, these foci will rupture and cause tuberculous meningitis, which is what and all will be there in this. There will be thick exudates in the basal cisterns and end arteritis. Okay, so just remember, this rich foci will rupture whenever there is immunity compromised or stress. That time it will rupture. Now let us see the clinical features of this child who comes in with tuberculous meningitis. So it will have fever, anorexia, okay, irritability, etc. It will have. Then second stage, it will go into seizures, focal deficits, meningeal signs. Meningeal signs could be your Kernig sign, Brudinski sign. Third stage will be of coma. Okay, so it's going very, very serious here. Hydrocephalus, cranial nerve palsies, some posturing, that is seizures, right? Optic atrophy, something to do with the optic nerve, nerve damage, eyes. Extrapyramidal signs, focal deficits are more common in tuberculous meningitis than other CNS infections. So remember, that is why they will ask you this in the exam. Tuberculous meningitis, very severe form of tuberculosis, and hydrocephalus, etc. can result. Looking at the diagnosis, you will check the CSF, right? You will do a lumbar puncture, get the CSF, and you check the CSF. So lumbar puncture, they are doing L3, L4 between, and the CSF you should not refrigerate, remember. And one more thing is, in childhood it's very difficult, so they can sedate the child before doing this. Now that you got the cerebrospinal fluid, what will you see in tuberculous meningitis? Look at this. Tuberculous meningitis is there here. So you will see that the CSF can be clear like this, or it can be cloudy like this. Okay, it can be clear or cloudy in tuberculous meningitis, and there can be normal pressure or increased pressure. So tuberculous meningitis, it can be either ways. What will you see mainly in the CSF? You'll see some cells, right? What cells? These are lymphocytes. You will see lymphocytes, okay? Or it can be lymphocytes with some neutrophils. But remember, lymphocytes, mainly in tuberculous meningitis. As usual in all infections, the proteins would have increased, and the glucose will decrease in bacterial causes, right? And what else will you do with the CSF? You can do some gram staining, AFB staining, basically to know what type of bacteria it is, right? So you can do an acid-fast bacilli staining, culture, you can do polymerase chain reaction, you can do to find exactly whether it is this organism. See, this type of bacilli, you will see acid-fast stained, right? Bacilli. This is Zeal-Nielsen staining. Of the CSF, no, this is more of the sputum that they have shown here. Guys, read everything about tuberculosis, okay? You will pass pediatrics, medicine, everything you will pass. So, what will you see in the CSF? Raised pressure. Yes, we saw raised pressure. Could be raised pressure. Lymphocytic predominance, increased protein, low sugar, everything we told you. Then, this will mimic bacterial meningitis, etc. You have to check correctly. Do acid-fast bacilli and check, okay? Acid-fast staining and check. Then you do neuroimaging, guys. You will see hydrocephalus that they have shown here. So this is tuberculous meningitis, okay? You can see hydrocephalus, basal exudates, etc. What is the first image? Where you can see subdural effusion, that is bacterial, okay? Bacterial meningitis. And these two are neurocysticercosis, parasitic. So you can see that neurocysticercosis, etc. So in this one, what are we concerned about in this video? We are reading only and only about tubercular meningitis. Okay. Let's go back to the textbook and read. So these people also will have a family history of tuberculosis. They can be fever, evening rise of temperature, and all those cough, all those symptoms of tuberculosis can be there. A positive Mantoux test, tuberculin test can be there. Chest X-ray, you can see all the tubercular findings. Then what will you do? You will send the CSF for gene expert, that is CBNAT, right? So you can check whether it is actually tuberculosis, and you can also check drug resistance to rifampicin. If there is no drug resistance to rifampicin, what treatment will you give? Anti-tubercular treatment, which is nothing but isoniazid, rifampicin, pyrazinamide, ethambutol, HRZE. This is standard thing that you will write for anti-tubercular treatment. So HRZE and HRE, right? So this is how they'll give HRZE and HRE. 2 months intensive phase, isoniazid, rifampicin, pyrazinamide, ethambutol. Then continuation for 4 months, isoniazid, rifampicin, ethambutol. So pediatric TB treatment, is it different? See, yes, here it says 4 months of intensive and 10 months of maintenance. I think this is for the meningitis they are talking about. Meningitis is requiring around more than a year of treatment. See, they are giving dexamethasone. This is very weird. Okay, in all meningitis, finally they are giving dexamethasone to prevent some sequel. Okay. So if there is obstructive hydrocephalus, they will have a CSF diversion by shunt or third ventriculostomy. Okay, if there is an obstructive hydrocephalus, that is. Prognosis, guys, we told you it is a very severe thing. So it can lead to a lot of other things like hydrocephalus, optic neuritis infarction, spinal block, right? So it can cause a lot of problems for people, but early treatment will give cure. See how tuberculosis is different from adult and child. In child, it can cause meningitis. See, hematogenous dissemination.